procurement system for drugs and medical supplies as envisioned by the Ministry of Public Health is now bearing fruit. Director of the Materials Management Unit, Ministry of Public Health, Cecil Jacques, said the change in the system of procurement of drugs and medical supplies will ensure there are no future stockouts.
The fears and the anxiety of stockouts and unavailability of medicines will end very soon. As a matter of fact, as I speak to you, a container of critical medicines will arrive on Monday, and our staff here at the MMU will have to work overtime to stock them, put them in inventory, and then to send them out.
This extra space will be needed since the new procurement system for drugs requires storage capacity for at least 1 year's supply.
It's what you call the learning curve. We have to start the 2018 process earlier. So once we start the 2019 process, in early 2018, we will not have this delay in the deliveries. We will have earlier deliveries.
I must say that it's a work in progress. We have 13 persons in the procurement unit who are assigned to do specific tasks to ensuring that when they're from the process of request to the process of delivery, all the logistics are put in place.
The Minister of Public Health, Valdo Lawrence, and an advisory team visited the Supplies Chain Management Complex, which will be the central location for inventory and distribution of procured items. She noted that since there will be no more shortages, the general public can now have confidence in accessing quality health at all public health facilities.
Persons will not stay home and listen to the negative comments that are being said, whether it's in the print media or otherwise, and decided they're not going to the health facilities for medical attention, and that they will turn up there because their government, with funds from their taxpayers, we have met our obligation to ensure that the necessary supplies, medical supplies and drugs, are available for the various facilities.
The minister noted that one of the factors contributing to the shortage of drugs and medical supplies in some regions is the inefficiency of the necessary regional personnel to uplift requested items and supplies from the bond in a timely manner. Minister Lawrence indicated that she has met with regional health officers and others of the regional administrations to address this issue.
Whether the regions are adhering to the call to uplift these drugs, which 3 months supply of the drugs, and to ensure that when they're coming with adequate transportation. You know, we've just had a good example of Linden. You know, they came, but they only came with one canter, which means that that canter will not be able to take the amount of supplies that we have here. And more so to look at the critical drugs that we're hearing so much about, not being available at the various health facilities. And we've been able to witness that many of them, or almost all of them, are here. And now it's just for the documentation and the dispatch. And I trust that through this exercise that the public will be able to take note that gauze and gloves and syringes and all the things that we have had issues with, that the ministry, that we have sought to correct that.
The health minister took the opportunity of this visit to be appraised of the process of stocking and distributing drugs and medical supplies. It was made clear that staff at the Diamond Bond will be required to work tirelessly to ensure that far-flung regional hospitals receive these much-needed supplies. For InfoHub, Stefan Gabriel.